Good morning, everyone. Today I shall be talking on bladeless blepharoplasty. I thank Dr. Aditi for giving me this opportunity to speak in the instruction course. There is a parallel instruction course which is running, and so it becomes difficult to be present in two places at one time, and therefore I'm making this through a recording, this presentation through a recording. I'm also grateful to all my colleagues who are on this panel, esteemed panel, and thank you once again for allowing me to be here with you all. My name is Debraj Shome, and we run a chain of clinics called the Aesthetic Clinics. We are headquartered in Mumbai, but we are in 6 cities in India as well. I'm American board certified in facial cosmetic surgery. Certain disclosures need to be in place first. Have been a faculty with all of these companies for a prolonged period of time, and obviously most of our results would not have been possible without the wonderful dermatology team, which is part of the aesthetic clinics. The eyes say it all. When we look at this celebrity, superstar, Bollywood megastar, we realize that the eyes say it all. When you look at his earlier pictures and you look at his current pictures, it's obvious that while the rest of the face has remained almost similar to before, it's the under eye areas which have started to age significantly. And there's a reason for that. The under eye areas have the thinnest skin of the human body, and this is also the part which moves a lot, blinking up to almost 15 times a minute, leading to this side or this part of the face aging quicker than other parts of the face. We all know that when we look at a youthful woman, especially a woman, but you see it in men as well, you see an OG curve, which is essentially a concavity in the under eye area, followed by the malar convexity, followed by another concavity, and then the mandibular convexity. This S-shaped curve is a sign of youth, and maintaining it is what we try to do with and without surgery. If you look carefully at this particular model, it's clear that she's very beautiful. But you've been paying so much attention to the symmetry of her eyes and the brow area, which are almost like mirror images of each other, that you've ignored her lips. If you look carefully now at the lower part of the face, you see that the lips have been badly done with fillers, and it is very asymmetrical between the right and the left sides. The reason you didn't mention it or you didn't notice it is because socially we've been primed to look into the eyes while talking, which is what you were doing, and therefore you almost missed the asymmetry of the lids. So, as oculofacial plastic surgeons and as ophthalmologists, we are in a position of strength because we have treated the eyes before, and this is the most important part, or in some sense, the jewel of the face. If we think of facial aging, it's very simple. It's Mother Gravity being ever so kind and pulling all our facial tissues downwards and medially. And as the facial tissues get pulled downwards and medially, we have the under eye hollows developing, and also the nasolabial folds, the melomental lines, and the jowl laxity occurring. So in some sense, it is the same sort of aging process which causes the under eye hollows, causes the under eye bags as we age, and also causes the laugh lines. And therefore, an aggregated way of treating this would be to move all the facial tissues upwards and laterally. You can't just treat the under eye area in isolation. It needs to be looked at holistically with the rest of the face. We've already spoken about this, and if you think of it, plastic surgeons believe that blepharoplasty is the panacea for all under eye treatments. Dermatologists tend to believe that fillers will solve all. The actual truth is that diagnosis and treatment requires a systematic diagnostic approach and individualized treatment. Now, if you see this particular patient, you'd probably say surgery and say blepharoplasty would be the way forwards. Yes, we would mostly do blepharoplasty, transconjunctival under eye blepharoplasty, possibly with some carbon dioxide laser resurfacing for tightening the skin on the skin side. However, what you need to understand is the quality of the skin cannot be improved with surgery alone. And therefore, most of these procedures will need a combined therapy or holistic approach as is being described. Now, we divide the under eye into various parts. We have morphological names for it, naming it as troughs, tunnels, valleys, and mountains, because that allows people to really understand what needs to happen in different parts of the eyes. And the tear trough deformity is the most important. Then we'll talk about the hypertrophic orbicularis oculi muscle or the tunnels, the problems created by the fat bags and the which are the mountains, and then the valleys which are also there on the face. So topographically describe the face and describe what we do as treatments for different parts of the face. So this is a paper of ours which has been published in Journal of Cosmetic Dermatology. Even when we use the fillers, we use it laterally, and by using it laterally, supraperiosteally, below the orbicularis oculi, we can have high G prime fillers which tend to last even 18 to 24 months being used, and the risks of bruising, etc., decrease significantly. In this, what we do is instead of injecting medially, as you can see the tear trough, we inject laterally and handle the volume deficit on the lateral side, leading to the orbicularis oculi becoming tighter, causing a hammock-like effect, and that causes the medial side to look better. And this we have found gives us very good results where the patient can go to work the very next day without the worry of any bruising, etc., which might occur in the medial parts. So this patient is a 28-year-old model coordinator. She came into us. She has volume deficit, as you can see. And using the technique that we've described, you can see how the lid cheek junction has become shorter, eyes appear much more rejuvenated, and she obviously appears much more fresher, younger, and rejuvenated. Similar for another, this 29-year-old lady who has tear trough deformities, and we've treated with fillers. Again, the lid cheek junction becomes shorter immediately, and you can see how the eyes look much more elegant, look much more rested and rejuvenated. Some people have these sort of problems when they are smiling. They have these hypertrophic orbicularis oculi, and that in turn means that when they are smiling, the eyes almost completely disappear because of the eyelid roll. And so, from that perspective, using botulinum toxin in the midpupillary line causes these eyes to open up beautifully, allowing the eyes to be visible. This is also used for flattening the rolls below the eyes and making the eyes more visible and larger, which in turn adds to the aesthetics of the entire look. This is a photograph which has been taken courtesy of Dr. Milind Naik. Some patients have asymmetry in the eyes, further accentuated between the right and the left sides when the patient is trying to smile. And in this particular patient, while she had been advised blepharoplasty surgery by multiple colleagues, we decided to do a little bit of botulinum toxin, like I've described for the hypertrophic orbicularis oculi, and fillers in the tear trough area, which in turn caused the eyes to open up and look much more rejuvenated and symmetrical even when she's smiling. And she's very happy. Fillers will last for 2 years or so. The Botox can be repeated every couple of months. You've avoided a surgery, and the cost is far lesser than blepharoplasty surgery. Some patients will have these eyelid bags. She's a 33-year-old. She didn't want surgery. Either you can remove the mountain by doing a blepharoplasty surgery, or you can rejuvenate it by doing fillers in the lateral and the inferolateral area, as we've described. In fact, in the post picture, you can even see the injection marks. And once you've done that, you can camouflage the eyelid bags. You don't need to remove it, and fillers can do a good job, especially in such asymmetrical cases or in young patients who don't want surgery. This is the patient immediately after a week or so, and you can see how she looks rested and completely symmetrical. Facial thread lifts are something that we do regularly. Facial thread lifts are important in raising the face, and when you raise the face with these thread lifts, you can actually go ahead and lift the facial tissues, thereby leading to upward and lateral displacement of the facial tissues, as we've described on an anti-aging procedure. We also use a lot of lasers around the eyes. Our two workhorse lasers are the Q-switched Nd:YAG laser, which is utilized for removing dark circles, and the fractional CO2 laser, which we use post a blepharoplasty for skin tightening as well as rejuvenation. These are some patients with peels, etc., and Q-switched Nd:YAG laser, which makes the under eye look more rejuvenated. Some patients with CO2 laser as well as fillers, which have avoided the surgery and therefore is blade free, and some other patients who've had multiple combination treatments, including CO2 laser, to make the under eyes look, skin look less crepey, more rejuvenated, and better looking. This is a patient who's undergone an upper eyelid blepharoplasty, a lower eyelid blepharoplasty, a mid-facelift, and CO2 lasers, and these are some of the results which can be created post-surgery as well. All in all, there are a number of techniques which can be done, and we should have different tools in our armamentarium. We should have different tools available to us. This is something which will make all our surgeries look better. This is something which will make patients happier. All in all, beautiful eyes is what gives rise to a beautiful face. By making sure that we have different blade, non-blade, and other types of eyelid rejuvenation procedures in our armamentarium, we can make sure that our patients are very happy, and there are various tools which are available for various people to look rejuvenated. I thank you once again for your kind attention and a patient hearing, and thank you once again for having me here.